This is the big reveal on how I look like after my operation. So again, uh, I had a Goretex Rhinoplasty. It's a nose job, and I will be showing you today how it would look like a day after your operation, and then I'm gonna give you a gist on how it was done, what you could expect, um, things that you need, and the usual do's and don'ts. And don't worry, if I do miss something, you can comment below and help out others as well to be guided when for this type of procedure. Okay, so I'm nervous. I'm gonna be showing my face to everyone. Okay, so are you ready? Right? Let me show you how to be a horror movie after your rhinoplasty. Okay, 3, 2, 1. Bam! There you go. There. Oh, walang matatakot. Ayan. So, as you can notice, I am having quite difficulty talking. It's because my lower lip is just the one moving. Because I cannot, well, I won't. I don't want to move my upper lip too much because I have stitches there. Excuse me. Alright. So, because I have stitches there and I don't want to move that too much. So, it's been just a day after my operation, and this is how you would look like for the next 3 to 7 days. Swollen, really swollen, especially around the eye area there, and then you will feel some discharges on your nose. I think yeah. Oh, I read about it. It's normal, and my doctor said it's normal. It's like parang yung anesthesia and everything, they will wear off siya, ganyan. So, ganon. Okay. So, what is this Goretex Rhinoplasty? So, this Goretex Rhinoplasty is not the old way of doing your nose lift or nose job. We don't use silicone anymore for this procedure. So what was used to me was my own ear cartilage. Kaya yung aking ear here is also covered with gauze there. At the back of my ear, if I'm not mistaken, kasi yun yung naramdaman ko nun, they cut the cartilage at the back of my ear. Well, I haven't seen how it looks like now kasi nga naka-cover pa siya. So, malalaman natin yan after I go back to my doctor, and then he will remove everything, all the cast, the suture. So, yan. Sa likod ng tenga natin, they would remove the cartilage and they would use that to insert in your nose, you know, to make it pointy. Right. And then, what I like about this procedure is that yung stitches niya, it's not the usual na nasa gilid. No, it's on your nose holes. That's how we call it. It's just around your nose holes, and then they would insert your cartilage there for your bridge, and then they would insert another cartilage here for your tip. So there. So very ano siya, very different from the usual rhinoplasty, I mean nose lift that they do. So okay naman. Okay siya. Maganda siya. I like it. Alright. So, the removal of this cast here, matigas na to, will be on the 7th day. So, highly likely I will be back my doctor's clinic on Monday, so that he will remove it. I think I'm not sure if this will be included as well. I think it would, um, do the removal, and then the initial healing, like, somewhat wearable na. Well, I call it that way. Wearable na yung new nose mo would be like 6 to 8 weeks. Pero depende pa rin yun sa sa healing process mo. If you're healing quickly or not. So, depende pa rin. Hopefully, I am healing very quickly. Ayun. Ang problema ko lang naman is the scarring. Kasi, very sensitive talaga yung skin ko. Even a small scratch, nagkakaroon ako ng bad scarring. Even just the normal scratching, nagkakaroon ako ng scarring. So, hopefully, this would not be that bad, and mag-heal siya right away, and mawala yung kanyang marks. Okay. Alright, so, what can you expect? Ito na siya. What to expect after your rhinoplasty? Ito na siya. Day 1. This is day 1. I had my surgery yesterday, and this is how I look like now. I'm not sure if I will be swelling more tomorrow, but this was not like this yesterday. So my entire eye area here is swelling. Although, hindi naman siya masakit. Kaya ganyan ko ba? Hindi naman siya masakit. Ayoko lang masyado pindutin. Baka mamaya masama pala. Anyway, ayun, hindi naman siya masakit. It's just like a blowfish. Yeah, that's what I look like. I look like a blowfish. Anyway, ayan. Yan siya. This is normal. Swelling the eye area. I've seen other posts na talagang sobra yung swelling nila. As in, hanggang dito na, as in, feeling ko nga kaya mataba yung mukha ko. Baka yung buong mukha ko talaga nagsuswell. Anyway, hindi naman nga kasi siya masakit, so I cannot really tell. Saka ito talaga yung saka chubby cheeks naman talaga ako. Pero hindi yata ganito. Anyway, so swelling siya around the eye area, and then here as well, ay naman, nararamdaman mo naman siya. Na parang siyang, may water sa loob, ganyan. Yan. And here as well, yeah, I think this is swelling as well, yeah. Pero hindi nga siya ganun kasakit. The pain, for me, because pain tolerance varies in every person. So, for me, from 1 to 10, I think this is just 3. Yeah. It's not even significant pain. Nakakairita lang itong nose cast na nilagay nila. Kasi parang, ayan, may ganyan sa ilong mo. Ganyan. So, tigas niya. Tapos, hindi mo maigalaw. Ganun, isip makati. Ganyan. So, anyway. Ayun na, so what to expect? There, swelling. Mapangit ka talaga. Mapangit ka for the next few days. But of course, it's all worth it. Hopefully. Okay. And then, next one is bleeding. Of course, siguro naman, talaga namang normal yung bleeding. Sabi din naman ni Doc, normal siya. Ay, siya nagbe-bleed siya na ganyan, ayan. But very minimal lang naman. And then you just clean it. By the way, you have to clean your nose twice a day. O, hindi to aalisin ha. Meron lang siya dito. Yung gauze area lang dito na nilagay ni Doc, and then sinabi ni Doc na yun lang yung aalisin mo, and then clean it, and then cover it again. Yun lang area na yun. So, I was told to do it twice a day. So, it depends on what your doctor is gonna tell you. So, hindi ko sinasabi na what applies to me would apply to you. There. So, bleeding. However, you have to observe. Okay? If you're getting too much bleeding, then you have to go to your doctor. Baka binubusa ka na ng dugo para sabihin mo pa, normal lang to. Ganyan, dugo-dugo ka lang siya. No. When it bleeds, you just, you clean it, and then you get a gauze, put a bit of pressure in it with a gauze, and then after nun, lagyan mo na ng antibiotic, and then you cover it, and then you're good. Pag naman hindi ganon na normal na, please don't hesitate to call your doctor, go to the hospital, and have them check it para safe tayo. Okay. Third is dry throat, of course. Kasi nga, we breathe mostly on the mouth. Kasi ako, I cannot breathe in the nose. I am breathing entirely using through my mouth. So I'm having a dry throat all day. So of course, obviously, ang solution dyan is drink lots of water. And I would suggest na use a straw for drinking para hindi ba aksidenteng mabunggo yung ilong mo. So straw is very convenient. I even use this for eating kasi nga naka-soft diet naman ako now. So, ayan, just have yourself a straw and a tumbler. Kung wala kayo dito, you can buy a disposable straw. So, it's fine. As long as meron kayo straw, it is just for your convenience. Well, preference pa rin naman. And then, of course, with dry throat, it comes with dry lips as well, which is very irritating. Alam mo yan? Kasi meron ka na ganito dito sa mukha mo, tapos nagda-dry lips ka pa, nakakairita siya. So what you can do is just use lip balms, ganyan. Oh, I am using this Korean brand of lip balm. It's called Laneige. This is a sleeping mask. Although hindi ko siya ginagamit lang for as a sleeping mask. It is really nice. It gives you it gives you plump lips, not dry. So I use it all day kasi sobrang dry talaga ng lips ko. That's why I need to use it all day. So again, this is Laneige sleeping mask, lip sleeping mask. Very nice lip balm. Okay, next is, of course, pain. Obviously, mukha kang binugbogo, para kang para kang napuruhan ng todo. Ganon. So, of course, expect that it can be painful. But as I have mentioned, hindi siya ganun kasakit. The pain is very manageable. It is not what I expected. Akala ko as talagang makirot siya. Kasi nga, diba, they, for my procedure, it's like they chiseled my nose bone, if that's how you call it, and then insert the cartilage there. So, but it's, hindi naman. Feeling ko maganda yung, painkiller na binigay sa akin ito. So, manageable naman siya. Wala naman. Yeah, it's working well. And, also pa pala, with the painkillers, do not take them when it's not hurting. Hanggat kaya mong i-handle yung pain, up until the moment na hindi na siya manageable, that's the only time na dapat tinitake mo yung painkillers. Kasi your body builds tolerance on it. So, pag nasobrahan ka na ng painkillers, hindi na yun magiging same effect as before. Kasi nga, nag-build na ng tolerance yung body mo dun sa certain amount ng painkillers na tinitake mo. So, you have to take more. So, that's why I'm very careful with painkillers and taking them. I only take them when I am not. When the pain is no longer bearable, that's what I do. Okay, we move on to the things that you need. Of course, you need your meds. So what I would suggest when you do your rhinoplasty, ask your doctor to get the full package. Yung kasama na lahat, yung meds mo, yung meds mo, lahat na yun, yung antibiotic, yung painkillers, yung ointment, sama mo na ito lahat. Kasi after yung operation mo, I don't think that you will be able to go to the pharmacy and purchase the things that you need. So just tell the doctor, give me all the things that I need, just include it in the package, and just pay for it after the operation. Tapos na. You go to your car, you go home, you rest, you take your meds. Diba? Less stress. Kasi stressful to eh. Medyo stressful siya. Alright. And another, yeah pala, before you're gonna do your operation, I'm sorry, I forgot. Please make sure na mayroong magdadrive sa'yo and may mag-a-assist sa'yo. Because most definitely you won't be able to drive yourself home. It's not because groggy ka with hindi eh. Meron siyang ibang feeling. By the way, yung nga palang anesthesia nito is just localized anesthesia, and I did not feel anything. Ang medyo masakit lang is yung paglalagay ng anesthesia, which is para ka lang nag-facial ng ilong. So it's fine, manageable still. Yun. So, yun lang ang advice ko. You have to get someone to drive you and another friend to assist you as well. So, I had two of my friends who came with me. One friend drove me and then another friend assisted me. So, para very convenient, very less stressful. Yun, para happy-happy. Okay. So, as I mentioned, my doctor gave me all the meds that I need. So I have the Selecosib as the painkillers. Really good. I'm not feeling anything at all when I take it, when the pain is unmanageable. Okay, and then I have the ciprofloxacin. This is the antibiotic that I take twice a day as prescribed by my doctor. So, depende to. It depends on your doctor kung ano yung antibiotic na ibibigay sa'yo and how many times you take it in a day. This is just for me. Okay, and then, of course, you need to have some gauze. You have to buy gauze. Kasi nga, as I mentioned, you're gonna clean the stitch area. So, and you need to cover it again. So, kailangan mo ng gauze. And with that, you have to buy your medical tape. Micropore. I'm not sure how they call this. I call this medical tape because you use it medically? I'm not sure. Anyway, basta yun. Sabi naman doon sa pharmacy. Sabi ko, yung tape. Medical. And then they gave me that. And then, don't forget to have your cotton tips. This is for applying your ointment. Please, 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 do not apply your ointment using your bare hands. That is so gross. Okay. And, oh, I almost forgot. Ito pala yun. This is the ointment that you're gonna put on your nose. So, it would still depend on what your doctor is gonna give you. Pero syempre, this is antibacterial ointment that you're gonna put on the stitches whenever you clean it twice a day. And that is just the prescription that my doctor gave me. So it could be different from one patient to another. Alright, so those medicines were from my doctor, and I added just 2 supplements to help me heal. I am expecting that these 2 supplements will bump will bump the healing process, make it quicker. So I am taking vitamin C. I'm taking 2,000 milligrams total in a day. So I take one tablet in a day, which is 1,000 milligrams, and then one tablet in the evening, which is also 1,000 milligrams. So all in all, that's 2,000. And then I am taking the Ultra Collagen Booster from Reservage. There, Ultra Collagen Booster. I'm taking 3 capsules in the morning and 1 capsule in the evening. So as we all know, collagen helps you regenerate cells. So that's why I'm taking this para sa cell regeneration and para mapabilis yung healing process, and of course para maganda yung skin. Yeah. Well, these two here actually are just a few of the supplements that I am taking. I'm taking a lot of supplements, but for this procedure, these two are the ones that I think are gonna help me heal faster. All right. Okay, so that's it for the meds and supplements that I'm using, and now we go to the do's and don'ts. So, do's. All right. Clean your stitches twice a day, or as prescribed by your doctor. So, as for me, my doctor told me to clean it in the morning and in the evening. So, I'm just gonna remove this. On my next video, I'm gonna show you how to clean it. Yeah, you're gonna see the stitches, some part of my nose here where they cut it with a knife. Anyway, all right, and then next, always take your antibiotic on time as prescribed by your doctor. Kasi nag-lapse yun eh, yung antibiotics. Kasi sinabi ng doctor mo na, oh, i-take mo to 8 hours in between. 8 hours in between. Kasi nag-lapse yung effectiveness niya. And the next would be, get enough sleep. Very important. You have to have a complete sleep. 7 to 8 hours a day. Yung sleep talagang tumutulong for us to repair ourselves. So, get enough sleep. Nasistress tayo pag nasistress yung katawan natin, yung skin natin when we are lacking sleep. Okay, and then drink lots of water. Okay. Drink lots of water because as we all know, or most of us know, drinking lots of water prevents or lessens the risk of infections, and of course water flushes out toxins in our body. And since we had anesthesia and everything when we had this procedure, so that would help flush that out as well. Alright, for the don'ts, huwag matigas ang ulo. For the don'ts, no smoking or vaping. So if you do have these vices, then you just have to stop it, dude. Just have to stop it, dude. So stop for the next 2 or 3 weeks. Once naka-recover na ng konti yung ilong mo, go back to it if you want to. You know, just to give your wound to recover normally without having to deal with your smoking or your vaping. And then next is, do not touch your nose all the time. Just freaking leave it alone. It's not going anywhere. It's on a cast. Ang dami kasi iba, touch, ay, parang ano ganyan. No, just freaking leave it alone. Do your work. Do your normal daily tasks, and just leave it alone. Kasi whenever you like always touch it, it can stress din yan. Pag yan na-stress, at yan pumaling at pumangit, ayan na tayo. Diba? Excuse me. There. Since I am breathing and talking at the same time through my mouth, so nagkakaroon din tayo ng throat irritation. And all you have to do is drink your water. Okay. Next is do not touch your nose or clean your nose with unsanitized hands. Common sense, diba? Huwag mong hawakan yung open wound nang madumi yung kamay mo. But I would suggest as well, so if you you have to sanitize your hands every time that you would touch your nose, or best thing to do is use some surgical gloves. And then, of course, dispose this. Hindi po ito, disposable kasi siya. One-time use. Once you use it, throw it away. Get a fresh one. Hindi po ito recyclable. Okay. And, lastly, no strenuous activities for the next 6 to 8 weeks. So, yung mga hit workout dyan, yung mga nagbo-boxing like me, we just have to take a break. What we could do, let's say after a week or two, we can do brisk walking kung talagang hindi mo matiis na hindi mag-exercise, or brisk walking would do after a week or two, depending kung ano na yung recovery na yung ilong. As I mentioned earlier, there are people who recovers faster than others. So, malalaman nyo yan. Anyway, after 7 days naman, nung post-op mo, pupunta ka naman doon sa doctor mo. So, sasabihin naman niya na, ay, ang bilis mag-recover ng wound mo. So, ay, mag-heal ng wound mo. So, you can ask him na, can I do brisk walking, ganyan. But definitely not strenuous activities. Okay na? Oo, mamaya, magbuhat ka na lang ng isang kabambigas dyan, okay na ba? Yung ilong mo malaglag. So, you just have to stop being stubborn and follow these basic, simple do's and don'ts. And I think we're good there. So, if you think I missed something, or if you have additional guidelines, you have tips, just comment below, and I'll include it in my next video. So again, thank you so much for bearing with my freaking ugly face today, and I'll see you in the next video. Please like and subscribe.